Hello everyone, welcome back to my channel, Dr.shil's Physio Victory. Today we'll discuss 25 most important biomechanics MCQ. Let's start. Today's first question is study about the forces producing motion is called as option A biotic, option B kinetics, option C kinematics, and option D biomechanics. The correct answer is option B kinetics. Kinetics studies the cause of motion. The focuses on muscle force, gravity, ground reaction force, torque, and momentum. Example, uh, why does the elbow flex when bicep contracts? That is basically of kinetics. Whereas kinematics deals with how the movement occurs, like speed, range of motion, and direction. Next, come to question number 2. So, this is the chain. This is biomechanics. Biomechanics is divided into two portions. One is statics and one is dynamics. Dynamics is divided into two portions. One is kinematics and one is kinetics. Kinetics deals with force and kinematics deals with the speed, direction, and range of motion. And kinetics is divided into two portions: osteokinematics and arthrokinematics. Osteokinematics is a bone movement and arthrokinematics is a joint play. Next question. The plane that divides the body into right and left half is option A frontal, option B sagittal, option C transverse, and option D coronal. Here the correct answer is sagittal. So this is sagittal plane which divides the body into right half and left half. This is coronal plane which divides the body into anterior and the posterior, and this is this is transverse plane, which divides the body into upper half and the lower half. Next question. The center of gravity of adult human is at dash percent at what percent of person's height? Option A 50%, option B 55%, option C 45%, and option D 60%. Here the correct answer is option B 55%. COG is a point where total body weight acts. So in an adult standing position, it is near about 55 to 57% of height lies anterior to S2 vertebrae. Next question. So this is the COG. Which class is lever of power? Option A first, option B second, option C third, and option D second and third. So here the correct answer is second order lever is called the lever of power. So this is a first order lever where the fulcrum is at the midpoint and the effort arm and the load arm is nearly the same. So the mechanical advantage is near about 1. Here this is second order lever where the fulcrum is at the end and the resistance uh, the effort is another end and load is load or resistance in the middle. So here the effort arm is larger than the resistance arm. So the mechanical advantage is greater than 1. So the mechanical advantage is the highest in second order lever. In third order lever, here is the fulcrum, load or resistance is the another end, effort is placed in the middle. So the effort arm is less than that of the resistance arm. So the mechanical advantage is less than that of the 1. So in third order lever, the mechanical advantage is low. So it is the second order lever, which is called the lever of power. Magnitude of motion can be measured in option A radian, option B pounds, option C kilos, and option D centimeter. Here the correct answer is option A radian. Angular motion is equals to rotation around axis units degree and radian SI unit. Next come to question number 6. In anatomical position of human body, the COG lies approximately anterior to dash vertebra. So the correct answer is S2 vertebra. It's very easy question, but it's a very important question frequently asked in the different entrance exams. Next question is center of gravity. The study of condition in which objects remain at rest is called as option A kinetics, option B kinematics, option C statics, and option D dynamics. Here the correct answer is option C static. There is no movement. If there is movement, that is called dynamics. I have just discussed in the first question. So coming into the next question. Two or more forces acts on the same segment in the same plane and in same line is dash force systems. Option A concurrent force, option B parallel force, option C linear force, and option D curvilinear force. Here the correct answer is option C linear force. So the characteristics of linear force is 1 same plane, 2 same line of action, and 3 same segment, like two people pulling rope in same direction. That is a linear force. The force component which is responsible for the stability of a joint is option A compressive force, option B destructive force, option C rotatory force, and option D all of the above. Here the clear answer is option A compressive force which stabilizing the joint. Destructive force basically destabilize the joint, and rotatory force allows the joint to move, or it helps in movement. Next question. Which of the following is the mechanically inefficient lever system? I have just discussed, so you should answer this in the comment box. Next question. When a muscle contracts, it creates a minimum of force vectors. Option A 1, option B 2, option 3, option C 3, and option D multiple. Here the correct answer is option B 2. When a muscle contracts, it, its force is resolved into two vectors. One is rotatory component, which is perpendicular, and one is translatory component, which is parallel. Here the rotatory component causes movement and responsible for joint motion, and the translatory component is either compressive or destructive, which affects joint stability. Next question. While lifting a weight by the right hand, it alters the COG to shift dash and dash. Option A, up and left. Option B, down and right. Option C, up and right. And option D, down and left. Here the correct answer is option C, up and right. When a person lifts a weight with the right hand, the combined center of gravity of the body uh, plus object changes. So, first of all, shift towards the right. The added mass is on the right side. The center of mass, the resultant center of mass moves uh, towards the towards the heavier side. Therefore, the COG shifted to the right. Next was the shift upward. When the weight is lifted, the mass of the object is above the previous resting level. The combined COG of the body and object system raises slightly. Majority of the muscles in the human body acts as part of dash lever. Option A first, option B second, option C third, and option D none. Here the correct answer is third. Third class lever is lever of speed, greater range of motion, and functional efficiency is more. Next question. The normal biomechanics of a joint is based on the option A bone, ligament, option C muscles, and option D all of the above. Here the correct answer is option D all of the above. Joint biomechanics depends on bone, ligament, and muscle. In bone, the shape and the congruency; in ligament, passive stability and limit excessive motion; the muscle is dynamic stability and controlled movement. Next question, question number 15. Theta represents the angle and it was originated from dash language. Option A Greek, option B Latin, option C French, and option D English. Here the correct answer is option A Greek. Theta is a Greek letter commonly used to denote joint angle, angular displacement, or rotation. Next question, question number 16. What kind of force system is found in a single muscle? Option A concurrent force, option B parallel force, option C linear force, and option D none of the above. Here the correct answer is option C linear force. Linear force is if the two forces are acting along the same line and producing the straight line motion is referred as the linear force. Example, if there is an object and two people pushing the object in this direction, this is called the linear force or pushing linear force. And concurrent force, concurrent force is if the two forces are acting on the object in different directions in and directions is perpendicular to each other, the resultant force will be in between two forces. It can be diagrammatically represented by the parallelogram method. So this is the image of concurrent force. So these are the two forces acting on the same point but in the different direction, and this is the resultant force. And in the left section, it is the parallel force. The two equal magnitudes are acting in the different in the same direction. The children are applying the two force in the end, and the fulcrum gives the counter force to maintain the seesaw in the neutral position. So parallel force is equal magnitude Next question. The universal x coordinate corresponds to plane. Option A, frontal. Option B, transverse. Option C, sagittal. And option D, coronal. Here, the correct answer is option C, sagittal. So, generally, this is the universal x coordinate and this is universal y coordinate. This is sagittal and this is coronal. Next question. The factors which determines a force vector is option A, point of application, option B, action line, and option C, magnitude of force, and option D, all of the above. Here, the correct answer is option D, all of the above. A force vector is completely defined by three factors. One is the point of application, where force acts. Example, tendon insertion, like tendon insertion. Two, uh, action line or line of action, or the direction which is orientation of force. And third is magnitude, which is strength of force. Next question. The study of altered and abnormal biomechanics is known as option A, applied anatomy, option B, applied physiology, option C, pathomechanics, and option D, pathology. The answer is very easy, that is pathomechanics. Pathomechanics is the study of abnormal movement due to injury, disease, or deformity. Next question. In the field of physiotherapy, the principle of torque is used to option A, patient transferring, option B, manual muscle testing, option C, exercise, and option D, all of the above. Here, the correct answer is option D, all of the above. Torque is force into momentum. Uh, in patient transfer, the shorter momentum is equals to less strain. In muscle testing, resistance placed basically resistance placement affects the torque, and in exercise prescription, changing lever arm alters difficulty. Next question, question number 21. Which of the following statement is incorrect in terms of force components? Option A, action line of motion, sorry, option A, action line of most muscles is parallel to the lever. Option B, the rotatory component of the muscle force is rarely larger than the translatory component. Option C, the translatory component of most muscle forces contribute to joint compression. Option D, joint compression contributes to its mobility. Here, the clear answer is option D, joint compression contributes to its mobility is the incorrect term. Next question, question number 22. The movement of an object around a fixed axis in which each point on the object moves through the same angle and the same time is known as dash motion. Here, option A is translatory, option B curvilinear, option C linear, and option D rotatory. Here, the correct answer is rotatory motion. So, in this diagram, this is motion. This is 1, this is 2, this is 3, and this is 4. In one diagram, this is linear motion. Or is also called the translatory motion. This is in image number 3. This is called curvilinear motion. Please tell me in the comment box. Image 4 represents which motion? Next question. Muscles creates movement based on the option A origin, option B insertion, option C net forces produced by it, and option D muscle bulk. Here the correct answer is option C net forces produced by it. A muscle effect depends on direction of pull, point of application, and the magnitude. Movement basically occurs due to resultant force. Next question. Anatomical pulleys are option A increases the magnitude, option B changes the direction, option C decreases the movement arm, and option D decreases the magnitude. Here the correct answer is option B changes the diagram. Anatomical pulleys are bony prominences that redirect muscle force and improve mechanical efficiency. Example patella, which is present in the quadriceps tendon. So this is basically changes the direction. Next question. Which of the following is essential for greater stability? Option A large BOS, option B closer COG, option C LOG outside the BOS, and option D both A and B. Here the correct answer is option D both A and B. So you can see here larger the base of support more the greater the stability and lower the COG greater the stability. Thank you for watching this video. If you find the video is helpful to you, please like, share with your friends, comment in the comment box if you find anything wrong. Thank you.